Good afternoon. I'm honored to reaffirm our government-to-government relationship on behalf of CDC and ATSDR. I wish my schedule allowed me to travel to Alaska and join you in person today, but Senior Health Scientists Delight Satter and Joanne Odenkirchen, Acting Deputy Director of CDC's Office of Tribal Affairs and Strategic Alliances, are there with you, and I look forward to their report on the conference and the input and recommendations they will share. At CDC, we strongly support and respect tribal sovereignty and self-determination for tribal governments in the United States, and we appreciate our ongoing collaboration to protect and improve public health. I want to take a moment to acknowledge the many tribal nations who were removed from the lands where CDC has built its campuses and where we now carry out our mission. The Muskogee, Creek, and Cherokee Nations, whose indigenous lands we are on at CDC and ATSDR Atlanta campuses, and the ancestral lands of the Nacotchtank and Anacostan and Piscataway Indian Nations, whose lands we are on at our Washington, D.C. offices. CDC is committed to growing and deepening our awareness of and our appreciation for the vibrant indigenous communities who continue to thrive and uphold their sacred relation to the land. CDC is truly committed to regular and robust tribal engagement, including attendance at gatherings such as this conference. Throughout the conference, you have heard presentations and attended sessions on work we are doing together and on projects CDC supports with funding. On the first day of the conference, the National Indian Health Board and CDC convened a listening session on engaging tribes in CDC's public health data modernization efforts. This session was held to discuss how tribes are included, to identify how tribes, tribal consortiums, and tribal epidemiology centers, or TECs, can better access public health data, to discuss how CDC can support tribes in accessing data from state and local health organizations, and to identify best practices, such as through electronic case reporting, to improve the ability of tribes, tribal consortiums, and TECs to detect, prevent, and respond to new and re-emerging infectious diseases. For more information on all the work CDC is doing to modernize data across the public health landscape, please visit our data modernization website at cdc.gov/surveillance/data-modernization. Other sessions on projects that are supported by CDC from the first day included the Youth and Elder Roundtable on COVID-19 that covered challenges faced and lessons learned during the COVID-19 pandemic. The Climate and Environmental Health Institute session highlighted the important work being done across Indian country to promote climate and environmental health. The Institute is a part of CDC's Climate Ready Tribes initiative funded by CDC's National Center for Environmental Health. And the Public Health Capacity Building and the Advancement of Tribal Public Health Infrastructure session covered NIHB's Strong Systems, Stronger Communities grant initiative funded by CDC, which supports tribal public health capacity building and advancement towards national public health accreditation standards and measures. On May 2nd, during the session on Understanding Our Public Health Systems in Indian Country, Dr. Jill Jim, Director of Public Health Infrastructure and Accreditation Programs at NIHB, presented on the Public Health in Indian Country Capacity Scan, or PICS. This national scan, supported by funding from CDC, is conducted by NIHB every 3 years to assess the capacity of tribal health and tribal public health organizations for delivering public health services. And yesterday, you may have attended the Lunch and Learn on infection prevention and control, where you heard about NIHB's Project First Line, an effort supported by CDC's National Center for Emerging and Zoonotic Infectious Diseases. During that Lunch and Learn, you would have heard how COVID-19 had shaped infection prevention practices and explored methods to implement infection prevention practices in clinical settings to reduce healthcare-associated disease transmission and occupational exposure for healthcare personnel. Earlier today, there were several sessions supported by CDC, including the session on navigating the missing and murdered Indigenous relatives crisis, where strategies were shared for preventing violence against American Indian and Alaska Native people. This is work we can support through findings to NIHB and the National Council of Urban Indian Health. In today's session on emerging preparedness plans for infectious disease outbreak response, opportunities for action and training for tribal communities, members of the Arizona Advisory Council on Indian Healthcare, an organization funded by the state of Arizona through CDC's COVID-19 funds, covered lessons learned in an emergency response and shared a draft emergency plan specific for tribal communities responding to an infectious disease outbreak. And the session just before this plenary provided an overview of the CDC's Foundation's Guide to Building Tribal Public Health Capacity. CDC provided funding to the foundation so tribes could hire temporary staff to support their response to COVID. Tomorrow, the final day of the conference, I hope you will be able to attend the session that will be led by NIHB's Infectious Disease Regional Institute about helping tribal health professionals and first responders minimize the impact of emerging and re-emerging infectious diseases on tribal communities and health systems. There will be a panel discussion on connecting with existing resources and tools and building disaster resilience across Indian country. This work is supported by funding from CDC. CDC's engagement with tribes, of course, extends far beyond this week's conference. In July, CDC will host a tribal consultation on our National Center for Injury Prevention and Control's Rape Prevention Education Program. Also this summer, our National Center for Emerging and Zoonotic Infectious Diseases will hold a listening session on their One Health strategic plan developed in collaboration with the Department of Agriculture and the Department of Interior. We will share the date as soon as it has been set. CDC and ATSDR's 26th Biannual Tribal Advisory Committee meeting, TAC, will take place in Oneida Nation within the Bemidji area in Wisconsin, September 6th and 7th. The TAC serves an important advisory role for CDC and ATSDR, exchanging information and advice on policies, guidance, and programmatic issues affecting the health of American Indian and Alaska Native people. The meeting will provide opportunities for tribal leaders to hear about and provide input on public health issues affecting tribal nations. There will be an option for virtual attendance both days, and I encourage you to join us. Please visit CDC's TAC website at cdc.gov/tribal/consultation-support for more information, including registration links and the agenda. Turning to funding, I have mentioned a number of projects CDC is funding. At the recent HHS annual tribal budget consultation, Lori Elmore, the acting deputy director of CDC's Office of Appropriations, gave a presentation on CDC's fiscal year 23 and 24 budgets. Dr. Leslie Dauphin of our National Center for State, Tribal, Local, and Territorial Public Health Infrastructure and Workforce explained that CDC would like to develop a 5-year plan to support tribal communities and public health infrastructure. She emphasized that we are looking down the road to work with the TAC to act, listen, and respond, align to what tribal communities need from CDC as well as our sister HHS agencies, and adjust based upon rapid response needs or emerging public health issues. Dr. Dauphin mentioned increases in funds for programs such as Healthy Tribes. In response, tribal leaders asked for a formal consultation on how those funds will be distributed, with an emphasis on how those resources could reach both smaller and larger tribes. Also announced at the consultation was the plan for a CDC-wide forum to review funding opportunity announcements, with an eye to streamlining the process and easing the burden of reporting requirements. Let me also take a minute to talk about some of the changes we are making at the way CDC is structured. We established the National Center for State, Tribal, Local, and Territorial Public Health Infrastructure and Workforce, I just mentioned, led by Dr. Dauphin. In creating this center, we consolidated the jurisdictional support functions that previously existed in CSTILTs and the infrastructure and workforce-related functions from CSELs. The center is the home for CDC's Office of Tribal Affairs and Strategic Alliances, OTASA, and critical functions such as our major CDC tribal and jurisdictional grants and cooperative agreements, our partnership and technical support, and key workforce activities. Our commitment to continually improve CDC's government-to-government relationship with tribes has not changed. The new center, which connects CDC's tribal work with a broad portfolio of public health infrastructure and workforce programs and staff, will strengthen our work in Indian country, and we are committed to OTASA's role as CDC's primary conduit for tribal engagement. In our new organizational structure, OTASA sits within the Center's Office of the Director, making sure it has visibility as it works across all of CDC in support of tribal nations. The information about our new organizational structure was shared in a tribal consultation on February 9th. At that time, we received input and recommendations from tribal leaders, and OTASA will be sharing a summary report by the end of May. The report will be sent to tribal leaders and also posted on our website. Let me close with a brief update on the state of COVID-19. The federal public health emergency for COVID-19 is planned to expire May 11th at the end of the day. This has brought some concerns about access to COVID resources and funding. Since early 2020, CDC has engaged with tribal nations and tribal public health organizations to help fight COVID-19, and we pledge to continue to work with tribes and tribal-serving organizations regarding all public health challenges. Our National Center for Immunization and Respiratory Diseases will hold a listening session and other engagements over the coming year to hear from tribal leaders and tribal-serving organizations on how we can continue to provide support and technical assistance. And please know that the availability of and access to and costs of COVID-19 vaccines and boosters are determined by the federal supply of purchased vaccines, not the public health emergency. So federally purchased COVID-19 vaccines and boosters will remain free and accessible to all people, regardless of insurance coverage, for as long as the supply lasts. I would like to close my formal remarks by restating how important the government-to-government relationship with tribal nations is to CDC and ATSDR, and that it has been my privilege to speak with you today. I recognize, and CDC recognizes, our special commitment and unique relationship with tribal nations, and we are committed to promoting the health and safety of American Indian and Alaska Native individuals. Thank you for the opportunity to partner with you and your communities and for your participation in the sessions this week. We look forward to meaningful engagements with all of you as a group and individually. Thank you.